So last time we met, you had back pain and just kind of not just feeling yourself after the baby, which how old is she now?
8 months.
Okay.
8 months.
So that was 7 months, so it's a month later. So tell everybody what...
Well, not sure entirely what happened, but I feel a lot more balanced, if that makes sense. I've always been a klutz. If there's a crack or a stone on the ground, I will find it and fall and trip. Not usually be able to catch myself, but lately, I feel more solid, if that makes sense.
Cool, yeah.
Better balance. And I almost did, but I was able to catch myself trip.
And one of the other things we found was when we were checking how your legs move, because they relate to your lower back, is the way they need to move for you to sit crisscross, which having a little one is important. That didn't work. How's that been doing?
Especially for feeding. I would get a little bit uncomfortable. Now I'm sitting a lot longer crisscross applesauce, especially because I'm an art teacher and I teach pre-K through 12. And in math, when I worked with kindergartners and youngers, that's how you sit all the time.
Yeah. Wow. Okay. So, hey, everybody. This is Amanda that we met before. Again, we were working through back pain, but it was really a lot related to just how tight everything was from her C-section. That scar, it's a big major surgery. And just as it's healing, even though it was all healed, everything's tight there. So we just supported and kind of helped all the muscles learn how to work together. So we're going to recheck that and just see what else is going on with hips and legs. But there's something that you actually want me to try to figure out.
Yeah, this knee has always been kind of a trick knee since I was a runner when I was younger. And would pop out of joint sometimes, but now this seems fine. And the other knee, I don't know if it's counterbalanced or what happened.
It's jealous.
It popped out and I was like, oh my gosh, because it's a very weird pain that you get. It's kind of just sharp and then it's gone. Yeah. But it kind of jumped right back in. I was like, what is that?
Okay, so I'm pretty sure we did some work on the right knee last time just to get it so it felt like it was more stable, and maybe the left needs a little more catching up. So we'll tune into that and see what's going on. And so let's get started. Just stand. I want to just make sure from the ground up, how are we doing? And we're just gonna back and forth. And by the way, for those of you who may be new, this is part of our assessing. This is the bridging technique. I'm Kara Lindell, the founder, and we're using an engineering-based problem-solving technique because my background is an engineer and a movement specialist. So looking at which parts, how they connect and flow together, and where it doesn't, that's what we support and use our really gentle muscle reset process to get all those muscles talking and working together again. So standing up seems... it's out of balance. So I can take you right to left, but going back to the right, you go to the middle and that's it. And then turning, that's pretty centered. So there is something that's a little wonky. So we'll see about that. Sit. Let's make sure seems to be in legs. When you're sitting, I'm finding what's going on more in your core. That's even. And then turning, that actually seems pretty even as well. And forward and back, that's actually pretty good. Lay down, let's see what's going on. On your back, and I think we are gonna wanna check the other way too, but I'm just gonna lift. Excellent. Okay, so there's still, you said the right felt good and the left is the one that's crazy.
I don't know if it was compensating or what.
So left, in this manner, you know what, I actually am going to guess that something with your whole pelvis is a little shifted because left is moving, when you're like this, left moves better than right. Yeah, even with that. So, mysteries. Love a good mystery. Yeah, you actually do move easier from the left to the right than the right. There's something over here. While you're here, I'm going to just use my little peanut. So is this kind of about where the C-section? A little bit.
Right about right here.
Okay, so I'm going to go more on the right side. And so again, even though we did a lot of support and just got the muscle interactions around that area working together again last time, there's so many layers. And it goes so deep that it's pretty common for most of the moms that we see with C-sections that it takes 2 or 3 times even to get through all of that. So I'm just putting a little compression, adding a little movement, and just helping those muscles all the way down in. There's a lot of layers in there. And this is more in the junction of how the abdominal muscles and the leg muscles are interacting with each other where they connect. And then I'm going to end up picking up your leg and kind of take it through some of the motions while I'm supporting. Relax. You can feel you're trying to help.
I don't even feel like I'm trying.
Oh, okay.
It's interesting.
Yeah, there. Okay. So that just, I know a lot of people, it's like, you don't want wiggly and jiggly. We actually like wiggling jiggly because that means all the muscles are just flowing and able to work together more. Okay, that feels really good on this side. Let me just lift and take it through the same transitions as the right. And, oh, I feel the difference. Okay. When I lift your right, your knee just automatically bends if I kind of come up a little bit. With the left,
oh my gosh. Yeah.
it's stuck. So there's some transition. I'm going to actually switch the support and go behind your knee. And just, you okay if I put a hand here? Just the support here a little bit. So the way that the hamstrings connect between the sit bones and they actually connect to the lower part of the knee, the calf bones, the tibia and fibula. They can get thrown off by stuff up at the top by your hip. There.
Okay, you got a crack.
Oh, there. Now it's bending. So it may be that with all the changes here, because I don't have photos to compare side to side, but boy, what struck me when Amanda walked in is she's standing up so much straighter. And so that shifts how all the legs are interconnecting with the pelvis, lower back, because they all connect together. Oh, there. That bends. Yeah. Okay, so I'm just going to hold a little bit more right here because it doesn't want to open out to the side. The name of that movement is called abduction. It's coming out like snow angels for all of us who have snow. And okay, so I'm pushing up from the foot. Her knee ought to just bend, and there it is. Oh, and was that ankle? Just a little pop.
Yeah.
So there. I don't know what. Okay, that seems super easy and it just glides. Let's see about this one. So if some of you may have watched some of previous episodes where we look at how the feet are interacting through the ankle, it's the same thing. We would just want this gliding motion all the way up because when our foot hits the ground, we want the ankle, the knee, the hip, the core to move and dissipate the force. Flip on your stomach. Let's see. I got you.
There it is.
Okay, so let's see if you're centered here. It's pretty close, but seems like one side is just, so that's the left. Okay, can you tell the difference?
Mm-hmm.
Yeah, so the left moves a whole lot easier than the right, and I think that may be what was part of. Amanda, roll toward me just a little bit. I'm going to put this underneath. Okay. There you go, and then roll back down. So I'll just put a little support there, and same idea. I want to get the motion from her ankle, knee, hip to work together, but it's coming from the opposite side. Instead of coming from the bottom, it's coming from the top. So a little bit as if you were kicking something. And, oh, this is stuck. Okay, so be supported a little differently. So you used to run cross country. Wow.
Mm-hmm.
There we go. The thing that's neat about cross country is it's not on a track.
Yeah.
It's out on the dirt and trails.
It was a lot of fun. I'm from Ohio, so it was close to the Appalachian area. We were at the foothills, so we had lots of hills.
Cool. Here. So what it feels like is that the muscles on the top of your foot and the from the shin have just checked out. Like they should be working together, and they're just like, we have to reintroduce them. I have no idea if there's anything in your past that would relate to that, or if that's just how it's always been. But we'll check the right one as well. Oh, there you go. Do you feel this, the shin area move when I push your foot?
Yeah.
Yeah. So it's sort of a sliding motion, like a trombone, how the two pipes slide one within the other, or a piston, depending on what you'd be familiar with. But that's, yeah. So it's like muscle filaments that are compressing together and then expanding. So let's see about this one. Yeah, well, that one's pretty good. And except your knee is a little off center to your foot, and I would rather have it a little more lined up. So, here. Okay, so if I'm moving your foot around, I see all this nice rolly motion up through your leg, except on your right one, I feel it all the way up through the thigh into the hip, and on the left one, guess what's not moving?
Hip. Doesn't feel like
The
it.
thigh and the hip. So we have to figure that out. So I'm gonna go ahead, put it down. I'm just gonna hold underneath her knee, and so I'm holding more at the ankle, or at the heel, sorry, instead of the front of the foot, and trying to connect in some more of these backside muscles, because what happens at the heel and the ankle and through the calf muscles should connect to the hamstring muscles, and that seems to be where the disconnect is. So I think, you know what, roll, I'm going to move the peanut, thank you, down to your knee. Lift up just a little bit, thank you, and there. So I want to get the hamstrings and the calf muscles. I'm just holding one end and rolling back and forth and letting the other end match up, almost like magnets where you have to get them lined up and they connect right up together on their own. That's the cool thing with people ask about muscle memory, and it's like, well, actually we're just kind of resetting it rather than, or plugging it back together, rather than you having to just keep exercising it. There you go. Can you feel the difference in how the leg moves?
My whole hip's now moving.
Yeah. Okay, so lift up. There we go. And let's see if that helps this. I think that's more centered. Oh yeah, it sure is. Yay. So flip back over. So roll back toward me.
Okay.
Yay. Okay, I'm just gonna check legs one more time. And so we're gonna go up, in and out. So that's really nice and fluent still. And this one, super easy. And turning here, very nice. And I'm gonna grab an arm and a leg, and I'm gonna roll you toward me. Lovely. And I'm going to come around and roll you the other way. We have to make sure everything matches. There you go. Actually, it feels really matched up. So sit up. And let's just check while you're sitting. Side to side. Whoops. You know, it's better when I'm behind you. So we have an even match. I'm going to hold on the side. Yeah, that's actually really centered and turning. Super easy. Forward and back. And then go ahead, stand up. Whoops. There we go. We're all tethered here. So side to side. Yeah, that actually, you feel real, it's like, it's a solid but a bouncy. Like it's grounded, but there's some dynamic kind control to it. And then we're going to go turning. There we go. Oh gosh, the turns are really springy and bouncy too.
Yeah, I feel actually a little taller. It sounds weird, but since less
yeah, well,
like positioned better.
Your legs are actually like elongated because of the knee. And think of if it was turned a little bit, it's like lined up and straighter. It's stacked up better. That's a better way to think of it. And then forward and back. So do you feel you're shifting through your feet?
Yeah.
So that's the interconnection at your ankle and to the shins.
Okay.
That's controlling you in the ground at the ground level.
Wow. Yeah, I definitely felt like when you were moving the hips, like it wouldn't do it, and then all of a sudden at the end, it was like, oh my gosh, it is completely working through.
So really cool. So just to recap, this is a follow-up from when we first worked through some C-section related things to help with back pain, but this was to figure out like a little tweaky knee thing that was still bothering her. And it just a little alignment shift coming out from the hip, knee, ankle, and just making sure left and right balance. And you're ready to start school again.
Right. It feels a lot, like you said, balance. You're just a little more centered and balanced. Like it's not like leaning to any side or favoring any side.
Yay. So if you found this episode interesting, give it a thumbs up. Subscribe to our channel for more of these. And if you'd like to be a guest, let us know. The info's in the show notes. If you don't want to be on video but want some help, you've had a C-section also. We're located just north of Chicago. Come on in. And if you're a professional, you want to learn how to do this too, we teach it, the bridging technique, and that information is also on our website. So thank you for joining us. Thank you.
Thank you.